Good afternoon, everybody. Good afternoon, Anthony. Good afternoon, Ismael. Good afternoon, Gloria. We've seen a long list of some of you that are joining from Africa, from Southeast Asia, also with questions, from Brazil, from Eastern Europe, and couples of guys from the developed world as well. We're gonna give ourselves 5 minutes so that everybody can join us during this talk that will last for another hour, and we hope that you will enjoy it very much. So 5 to 10 minutes, we're gonna be waiting for other guests to join us. Thank you for making the time today, and we're gonna get back to you. 2 more minutes to go, and we should all start discussing this very interesting topic of what healthcare financing is and payment models that are existing on the market for emerging countries when it comes to healthcare. Exciting topic because we all know if there is no sustainable payment approach or financing means, it's always difficult to have delivery properly done. Within the MEDx team, we've investigated for quite some time this topic, which is also the core of our solution, but we'll come back to that in a bit. Let's just get started. What a pleasure having many of you connected today. In my normal routine as the founder and CEO of this digital hospital company and startup, I normally on a Saturday go sporting and then go to the market and later spend some time with family. Super excited, and I was excited already when I was sporting this morning to know that this extended family will join me for this discussion, because this is something that we are passionate about within the team of MEDx.Care, and we are super excited to start sharing the knowledge we've been accumulating for the last 3 years with you, and we hope that you're going to take this story beyond the border and beyond yourself and share it with other people. Now, well, what can I say? Thanks once more. So 2 months ago, actually, we started this journey of a webinar. I would say it was a newly version launched of webinar where MEDx is on the drive of sharing the story it's been going through as a company, but also as observation of the market when it comes to emerging countries. Because when we hear healthcare, innovative healthcare, many are really busy in the developed world, but many are also busy in the emerging countries. We took it as a personal challenge and as a personal drive to take you through the journey and of hearing the story of the emerging country, of understanding what's going on over there and what is not going on. So 2 months ago, we started with this webinar about the digital hospital and its power in the emerging countries, where we highlighted a lot of the activities that are going on in the e-health and in the digital health space. If you remember well, and you can always get back to our YouTube channel to see all how great the landscape is starting to look like, from having solution in the financing space to modern SMS models towards dermatology issues being dealt with technology. One of the critical things we realized, though, is that the connection between all those elements are still missing, and this is again where MEDx.Care kicks in, because after observing the issues that emerging countries are suffering from, let me remind you what those 5 issues are. So one is about human resources, having enough doctors and nurses. We are at the number of 2 for 10,000 people today, and that's ridiculous because the World Health Organization recommends 2.3 for 1,000. You can imagine how big the gap is and how many people cannot get access to quality or to even healthcare because there's no human power to be able to support them. The second topic that is an issue in emerging countries is care financing, which is a topic we will address deeply today. I'm going to come back deeper into that topic later after this slide. Then we have the problem of care knowledge. And the knowledge is not because the healthcare resources in emerging countries do not want to educate themselves, but the pressure they get makes it so difficult for them to be able to move and go and seek that information and that knowledge. Also there, MEDx.Care plays a critical role by making sure that knowledge, research and development and books are readily made available on their smartphone and on their computer. The fourth topic that needs to be addressed is the topic of infrastructure, topic that many companies, many NGOs are highly working on. But you can imagine that if infrastructure is in place and the other three issues are not dealt with, there is still an unbalance because you need to find the smart financing model for this infrastructure to be maintained. You need to have the people that will work within these infrastructures. And that's critically some of the things MEDx looked at. How do we make sure that each of the pillars get together within the umbrella of the hospital so that we can create an even better and an even balanced world when it comes to healthcare systems in emerging countries. The last topic, very critical topic, is about regulation policies, and there the governments play a critical role. So again, backstory, during our webinar of the digital hospital, we addressed all of this. So let's move now to the core topic of today, with its title being Payer 2.0 and its impact on the emerging countries. Now, out of the 5 problems I just highlighted, one, and I would say the core, is about how do we sustainably fund healthcare systems in emerging countries so that delivery is done in a very great way, so that there is less people dying, so that we have doctors that have enough means to do their work as they should do it. That's what we're gonna address today. Ultimately, what it means is that we wish that all of you connected will learn a little more about the ecosystem of healthcare financing in emerging countries. We wish that by the end of this webinar that you understand its structure, the impact on care delivery. On the third point, that you understand what the innovative players, and we've listed couples of them for you, including MEDx.Care, obviously, but there is competition, there are lots of youngsters doing amazing stuff out there that we want to share with each of you. And the last point will be really digging into what MEDx.Care has put in place, not only conceptually, but also tangibly, to facilitate this whole care financing model for the emerging countries. So, this is going to be an interesting picture, a picture I shared a couple of weeks ago and on social media to see how discussion will be going. It's a picture from the World Bank that highlights that if you can see the orange group, health spending, 12% of the $3 trillion today available for healthcare is spent in emerging countries, in low and middle income countries. And what we observe, they have the biggest pressure in terms of burden of diseases. How incredible is this picture? While the developed world, with 80% of its fund and its finances that they've organized and structured, because we need to give them credit to that, they only have a limited portion of burden and health issues. Why is this happening? How can we turn this around and not turn around that one is abusing the other? That's not what is happening. One needs to structure itself better. One needs to learn from another word. One needs to exchange and communicate and connect better with the other word. And again, for me, that's where MEDx.Care plays a critical role, because we've been observing the ecosystem as a whole. Now, next to the picture, as I highlighted already, 3.2 trillion is spent on healthcare nowadays globally. 12% is for the emerging country. That's a rough 350 billion. But that's also the part of the world where we have the biggest population, Where we have the upcoming biggest population, because the idea is that it will increase towards 7 to 8 billion by 2050. Let's imagine how much more pressure we will have in that part of the world. Now, before we dig further into what are the models existing, it might be good to make a step back and look into the past and what happened in terms of healthcare in the past. So the whole healthcare financing in reality only dates from the 1880s, where because of the research and innovation around research of medicine, a government in the US, in UK and in Germany, because those were the three beds of where healthcare financing and the need of structuring the payment model around healthcare were born. They observe with the rise of new medication, new research, new product coming on the market, that the locals were not capable of paying everything by themselves. And that's where NHS was born in the case of England, because what's funny when you read and watch the history of healthcare financing is that what we see today has been and started that way. So in England, when they realize they need to support their population, they tell themselves, we're going to make it free and the government is going to take care of everything. And that has been, and that is still today. In Germany, they say, we will support a part, but the population needs to support another part. It's been from the beginning, and it's always been the same today. And in the US, we know how much scattered it is, and only the Affordable Care Act that came in tried to close many of the gaps. We have more of a model where you're wealthy, you can afford the support, and if you're not healthy, often it's out of pocket. Mr. Obama tried to change the scenery. We will see what will happen with President Trump when he takes over, because there was a big debate on the Obamacare. But we are not here for the US. The main purpose of this is to discuss the emerging country situation. So if we move from the first picture towards the second, what is interesting to observe on the second picture is all dotted lines are mainly for emerging countries. And you see an evolution. It doesn't start in the 80s. We're talking about beginning 19s, but we see that they cocked up in terms of funding and supporting the population for healthcare very, very little later on. So somewhere in the mid-19s, do we observe emerging countries starting to do something in that space? And even later for countries like Rwanda, so when we talk of Africa, what does it lead us to? And I think that's going to be our next picture. A big part of healthcare financing is still quite out-of-pocket driven and still quite community-based driven. But let's talk about it on our next slide. So again, apology for the quality of the screen with the 360 degrees view. I hope by moving your phone or your computer, you're capable of viewing it better. I'm gonna do the resharing because I've just been signaled that it might help in improving the quality. And let's continue the discussion from there, because we are very keen on making sure that you can fully follow this discussion. That is a very important discussion. So the resharing has been done, and I hope that this has helped improve the quality of the video and of the presentation. Still not. In any case, we are now on our next slide, which is all about the current state of healthcare financing in general. What you will see on the top of the slide, even if you're on the 360 degrees view and you move your phone or your computer, you will be able to see that there are there are 4 key pillars when it comes to healthcare financing today across the globe. The same structure is used across the globe. 1, it's always recommended to collect revenue, because you cannot fund if you don't know where the source of the money will come from. We will discuss later the different type of revenue collection that exist, but in any country in the world, there's always a step, either public or private, where there is revenue collection to be done. From the revenue collection, you move into the risk pooling approach. And the risk pooling approach is more about sharing the revenue that is initially collected in a very fair way. Fair in terms of, because once you have the revenue, you need to make sure that the quality of delivery is against a certain standard. But who has the right quality delivery? How do we define which route is the best in terms of quality of delivery, or quality delivery, and who therefore should have the fund for that? The risk pooling space, which is the space you see after the revenue collection, if you see my cursor moving, is that reallocation of the collected revenue towards a kind of scheme. And that scheme, again, is defined by the authority. That scheme can be, as you see, it's called RAP today. It's the allocation of the money for purchasing the necessary stuff so that the delivery, or let's say the service provision of healthcare, is properly done, both from a public or from a private sector point of view. Now, a little complex picture, but bear with me. Let's move a bit downward. So from a revenue collection, there are many ways to collect revenues, as I highlighted earlier. It can be collected through taxes, through public charges, through grants, through loans, through support from donors, but also through communities, and highly through out-of-pocket. And we'll later discuss what the out-of-pocket means for emerging countries versus what is happening in the developed world. So if we stick still with the revenue collection, because after a lot of study, we realized that that is critically where a big part of the issue sits. But that's also where MEDx, together with some startups, are looking to support in having innovative ways to finance and to fund and to support this space for government, for the locals, for the human beings, for a better humanity. Ultimately, on the public sector, if you watch and you see the PowerPoint, today, emerging countries allocate 18% of the collected revenue towards, there's only 80% that is collected by the emerging countries for that space. But be careful, the 18% still needs to be split between infrastructure activities, meaning roads and buildings. The 18% still is meant, so you can imagine all the other steps that needs to be done. And out of those 18% should also come healthcare. Today, in the developed world, they collect around 40 to 45% of their GDP to be pushed into public activities. And in those 40-45%, there's also the fund made available for healthcare. And let's not ignore the fact that the GDP size of the developed world versus what we see in the developing countries, the difference is just tremendous. So from that perspective, we have healthcare suffering a lot, because in emerging countries, there's so much that still needs to be done in education, in poverty alleviation, before healthcare can come. And that puts an extreme pressure on many of those countries. I'm not going to talk about corruption. I'm not going to talk about tax evasion, which is a statement. I will share something that happened on social media because I shared this topic in couples of groups, and we had extensive discussion where everybody was very vocal on, why don't you look into the corruption space? Why don't you look into the tax evasion space? And they are all valuable areas to look into, but those need structural fixing. Now, if we move from public, where there is already tremendous pressure because of the limited amount collected, plus all the complexity of the public sector ecosystem, we go into the private sector. So grants come, loans come, we should have private insurance. What we observe today is, compared to the developed world, almost 72% of the revenue needs to be generated in the private sector. And out of those 72%, 90% is out of pocket. We're talking about a part of the world that is quite poor, struggling to have a job, and they need to get out of their pocket roughly 70% of what is needed in order to finance their healthcare, to stay alive, to stay healthy. The inequality is just incredible. And this is, again, where we need to all commonly work in order to make a difference. Because as soon as this part is a little better organized, we strongly believe within MEDx that a lot of changes can happen across the end-to-end process. Now we're going to move forward into, I talked about the discussion that took place online. I thought I was going to share a little bit about that. So once I made the post online about how scary the 12% of spending is allocated to emerging countries versus 80% of the burden, I had Wayne that came to me based in the US and said, well, be careful, in the US we still see this inequity. The poor still suffer from not getting the proper and the quality healthcare. But I mean, it's fair, that comment coming from the US, because again, the model is built that way. Then we had the medicals that is based in Brazil, so also very linked to this topic, and where this topic is much more important. That came up with a comment about corruption, about how much the world would be different if people just wanted to do what needed to be done. It's from personal experience that he's making that statement. I think Sergio was also from Brazil, and same comment he made. If you go in the Innovation for Health group within LinkedIn, you should be able to find this discussion that is still ongoing. The last one from Laurent Perlin was an interesting one, because he's the one that came up with the $1 trillion or euro that is always evading for many of those countries and not redistributed properly. How much can we look in that space in order to support what's going on in healthcare and in order to support better healthcare? We will continue the discussion. Don't hesitate to join that discussion whenever needed, because I think we will need all brains to ultimately get to the right solution. Why this topic today? Why do we need to look into doing it differently, I would say? Because what we've done up until now, at least in emerging countries, it's not getting us yet to the full healthy organization. The developed world has done a tremendous job in getting where they are. But yes, look, it is a right everyone should have access to healthcare. We also all probably heard about the Sustainable Development Goals that has been launched by the World Health Organization, and good health and well-being is one of the critical ones. By 2030, they want to be able to get to the best of healthcare. Couples of countries are doing great here. I think Rwanda is showing an amazing progress. I still believe Brazil has done tremendously well as well. Yes, there were some statements that were made coming from the government, but still, if we compare MEDx having done the studying, we realize that, yeah, ultimately they're not doing too bad. Couples of countries in Southeast Asia are also improving. We're just not there yet, and we all need to find innovative ways to be able to support on those SDGs. So now moving forward into the actual solution that MEDx and some others are bringing to market. I hope some of you have a better visibility now of the screen. In any case, we definitely will send you the PowerPoint afterwards, and the story will be made available at least vocally, and we'll see how we can support in making sure that you get the right picture and that some of your questions are answered at the end of the presentation. Now, one of the things that is important to highlight is how do we as MEDx, as an organization, want to make a difference here? So now, fully relying on aid doesn't help. We know there's an estimated $300 billion that is sent yearly by family members across the globe to support each other in emerging countries. This is where MEDx wants to play a role. This is where we want to make a difference. Do we have the capability to change the full model? Absolutely not. But what can we do with this $300 billion that is sent yearly towards emerging countries? Well, we had extensive conversation with the diaspora. What the diaspora told us is 5 to 10% of that money, which is a rough $20 to $30 billion yearly, is meant for healthcare. They wish their family could use it to get access to proper healthcare. Now, one thing to highlight, it's one thing to get the money, it's another thing to get quality delivery. And quality delivery means a great balance between the people in the healthcare sector, the infrastructure in the healthcare sector, and having them partly balanced, but partly knowledgeable to be able to get the money that is sent by the diaspora. And that balance is missing today. So at the delivery level, we have a problem of proper resource allocation in between people, processes, system, and therefore the money. And again, there MEDx is planning and is working on playing a critical role. So first step first, we're going to play the game very much on the private sector, using remittance money, the 5 to 10%, and make sure that that money is available either to the communities or to the people directly. So you could use that money to buy insurance, and therefore we are looking and we are willing to work with insurance companies that want to support the healthcare system in emerging countries. Or you could use that money to out of pocket yourself pay directly into the healthcare delivery environment. Now, because MEDx is aware that the delivery environment is also in trouble, we came up in our solution, and that's not the core of today's discussion. We came up in our solution with also a way to use technology in order to get access to greater healthcare resources, beyond the border healthcare resources, beyond the border healthcare specialties, because locally this is missing today. And what it implies is I might get the cash as a population. Who do I go to get that care whenever I need it? Who do I give the money to? Because there's not enough doctors, there's not enough nurses, we do not have enough laboratorians and enough specialists there. So we need to find them somewhere and get these guys engaged towards those countries where there is lack. And MEDx is critically working on making sure that the balance between people, money, and quality healthcare and knowledge healthcare is also in place. Now, moving forward into the current landscape, because we talked quite a bit about MEDx, but what does exist out there? Whenever when the next slide is up, you would be able to see already such a big ecosystem, especially in emerging countries. When we talk insurance, obviously you can imagine in the automotive area, you need it. In the data area, we need it. They're all related to us as human beings. In the education space, you need it because healthcare is also getting knowledge, like I mentioned earlier. So here you can see the landscape of the InsurTech world. But what is very intriguing is that, first of all, the dedicated health space area is such a limited amount of it. That's one. And the second one is it's very developed countries solution driven. Because back to what I've said earlier, 90% out of pocket. The insurance model is not yet fully used. So I'm going to move. There are two big players. Well, two big players. I'll call it two competitors currently on the market when it comes to looking at the financing of healthcare differently in emerging countries. And you will see that coming on your screen right now. We have Yeni. Yeni is a young startup that launched 1 to 2 years ago, dedicated in making sure that there's a kind of a top-up model into a card, and that card, with the card, you can always get access on a point of sales at the healthcare space or hospital or pharmacies, and use this card in order to pay based on the money that has been topped up globally. Very interesting model, very nice model. We just need to be careful of having cash being digitalized, and even if digitalized and extra digital money is pushed in here, that it doesn't serve for anything further, because who are the doctor I'm gonna give this money to? And yes, I might go to the pharmacy, but best delivery model will be that I see a doctor that recommends me a medication, and then I go to the pharmacy. Then we have MTBA. MTBA is a product from Farm Access in combination with Safaricom. Many of you have probably heard about M-Pesa. So this is an extension of the M-Pesa model, also focusing on more of a credit saving type of model of cash or of digital money, and whenever needed, tapping into it in order to get access out of pocket to better healthcare. MTBA is currently operational in Kenya, Yeni in Senegal, and like I mentioned earlier, MEDx is launched also a year ago, and we're starting to put fully our foot on Nigeria, Uganda. We've tried talking and working with few hospitals. We're doing some further pilot in South Africa, and Congo is and Senegal are also requesting to try the product. So pretty extended landscape at this stage, and making slowly our progress. So these are the big players, and I do believe that we will see more players coming into that space, because there's more, and there's a lot we need to do ultimately for the population, because it shouldn't be just about the financing or the payment or the money. It should be about getting the financing so that the end of the chain, meaning people staying alive, people staying healthy, is achieved. And I'm sure many of us have that as key focus. Health is now widely recognized as a basic human right. And within MEDx, we strongly believe that we should all fight, push, and contribute in making sure that the emerging countries reorganize itself in innovative ways or in different ways, and start looking at the world differently. Because a healthier community and a healthy community will definitely lead to better people, better economy, stable economy, and a better world, ultimately. Well, from this word and with this word, I say thank you, and I wish you an amazing end of the day. Take good care of yourself. Bye-bye.